everyone, so let's move towards our today's topic, which is
the topic that is development of thyroid gland. Now we have already talked about the thyroid gland and what is thyroid hormones, how it will release, how it will form, how it will work. Now the point is thyroid gland. As we have already know that thyroid gland is present in the anterior region of the neck and anterior to the trachea. Thyroid gland is present and it is an exocrine gland. So now development. It is the first exocrine gland in the embryo which develops, and what happened basically after 24th day of fertilization. Okay, the 24th day of fertilization from the floor of pharynx. Okay, the area of the embryo, the part of the embryo which forms pharynx, from that obviously it is present at the level of the first pharyngeal pouch. So at that level, from the from the floor of the pharynx, an extension, a pouch like extension will be arrive, and that extension will form thyroid gland. That extension, that pouch like extension is connected with the pharynx, and that connecting duct is called as thyroglossal duct. Now remember this point, that this whole thing which I have told you, that pouch like extension is formed, it will occur above the trachea. Okay, so basically this whole process is above trachea, but the final destination is something different. The final site of the thyroid gland is in the anterior region of the trachea, but anterior region of the trachea. But right now, at the 24th day of fertilization, there will be that the formation of the thyroid gland takes place above the trachea. Okay, now slowly it will develop. It will form two lobes which is connected with the isthmus, and they will move downward above the trachea towards its final location. And at 7th week, the thyroid gland, you will say that thyroid gland is present at its final position, and you will also see that the thyroglossal duct will be degenerate. Okay, and when the thyroglossal degenerate, it will form the foramen cecum on the tongue. Okay, so this was the topic regarding development of thyroid gland, and this is the point which is very much important, that at 7th week thyroid gland attains its final shape and attains its final site. Now at the 10th week, obviously thyroid follicle will appear. What are thyroid follicle? We have already discussed in the physiology lecture. And one more point, that the thyroid follicle will start appearing, and by the end of 20th week, okay, at the end of 20th week, the level of thyroid hormone and thyroxine, as you know, thyroxine is also a thyroid hormone, so that will increase, and they will start producing, they will start releasing. Okay, and if I talk about a clinical point which is very much important, that if thyroid gland is not present on its usual site, what is the usual site of the thyroid gland? It is present in the anterior side of the neck, anterior to the trachea. But if it is not present there, and it is present other than its usual site, that condition is called as ectopic thyroid gland. As we have already discussed in the fetal development lectures, that ectopic pregnancy. What is ectopic pregnancy? Ectopic pregnancy is the pregnancy which occurs other than its usual site. Same goes for that. What is ectopic thyroid gland? The thyroid gland, if it is not present on its usual site, that condition is called as ectopic thyroid gland. So this was the whole topic regarding development of thyroid gland. Till then, work hard, study hard, and good luck. Bye bye. Thank you. Take care.